Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system dedicated to health care and education in the greater New Orleans area. As an academic medical center, we pride ourselves on being on the pulse of what's happening in healthcare innovation and really the future of healthcare in the community. On today's episode, we have LCMC Health Senior Vice President of Hospital Services, Rob Calhoun. Thanks for joining us today, Rob.
Thanks so much, Kristen. Glad to be here.
Tell us a little bit more about your journey as an LCMC Health Senior Vice President, how you got here.
I'm originally from South Carolina. My wife is from Houma, so we were delighted to get back home and be closer to family. Started with LCMC in 2019 and became the CEO of West Jefferson Medical Center. Had a great experience there. Been there for almost 6 years. And then more recently, there was a desire to have more focus on the service line. So about 3 months ago, I got this promotion. I'm really excited to be in this position.
That's exciting, and I'm so glad that you made your way back to Louisiana to do some great work here. So when we talk about service lines, I think that there's just, a very loose interpretation of what that means and how it truly is impactful. Talk to us a little bit about the evolution of service lines since you've been here and kind of where do we start, how do we get here, and where we're going?
That's a great question. So the service lines have changed quite a bit over the past few years. Last year, we had the CEOs working on specific service lines in addition to our physicians and our service line leads. But we realized that we need a heavy focus on the service lines. And so they brought me in to have somebody that wakes up every single day focusing on growth, focusing on access, and how we can grow LCMC. And that's really the goal of creating this position and my focus on it.
That's great. So how does our relationship with educational institutions and being academic medical centers really around the system, how does that impact service line development and really improve patient experience and elevate care?
It doesn't necessarily change what we've been doing. It just provides probably more coordination and more action around it. The way I view the goals for the service lines is really to increase access. We want to make sure that our patients throughout the entire system and throughout all the parishes have access to LCMC Health. I view this as a way for me to really meet our talented doctors across the entire system, make sure we're engaging them, we're understanding what their goals and objectives are for their service lines, and how we can incorporate those into our strategies. We want to create strategic plans for all the service lines so we know very clearly what we're working on and how to get there. And then more than anything else, we want to create action. So at the end of the day, it's great to put all these things down on paper, but we got to make them happen. And so my goal is to wake up every single day thinking about service lines, how I can drive growth and how I can create action across the system to create positive change for all of our patients.
Yeah, that's exciting. And help us understand what are some of when we think about it being translated into real life, as a patient, why do I care that a service line is being built? What does that mean for us when we're receiving care?
Well, as a patient, you really care about access. It's less about the service lines and probably more about getting to see your doctor, having a great experience, and really having your care coordinated in the right way. So it's less stressful for you. We know people don't always want to come to the hospitals, so we want to make that experience as pleasant as possible. And so my role in all that is to make all the stuff that happens behind the scenes more easy for patients and make a great experience for them.
That's so important. And thinking about behind the scenes, I know that there's a lot of initiatives and there's a lot of work happening to make sure that we're elevating care and experience. But tell us a little bit about that piece about elevating care and what are some of the premier service lines doing that?
Well, we have a lot of fantastic service lines, which I'm proud to talk about today. Neuroscience, heart and vascular care, cancer care, surgery, primary care, women's health, urology, and laboratory services. And there's a lot of exciting things going on in those spaces. I'm going to touch on a few today.
Great. So tell us a little bit about cardiology and oncology. When we think about the needs here in Louisiana, we think cardiology, oncology, women's services, and so much more. But what are some of the highlights that are happening in those areas?
So one of the cool things that's going on right now in the cardiology space is at EJ. EJ just completed 3 LVADs year to date. And the LVAD is a procedure that helps to pump the heart pump blood. They're also in the process of starting a heart transplant program, which is incredible. It's going to be the premier destination in the state of Louisiana. It's interesting because Louisiana is a net exporter of hearts. So we actually don't do as many in the state of Louisiana. And so it's so important for us to make sure that those services are available to our patients and that we can provide excellent care when they need it.
That's great. And what about oncology? Again, that's a huge need in this state, in this region. So tell us what's happening there.
Well, we've invested in a lot of technology that's going to help improve outcomes in Louisiana. There's a new program called ION and a lung screening program that we're rolling out that's going to help for early detection. And for lung cancers, it's really difficult to get to those cancers. So we have a robot that's going to allow us to actually go in and get those tumors out and also not create a lot of damage while doing so. So it's minimally invasive. Really excited about that. So it's really going to improve outcomes and also improve survivorship.
Sure. So it sounds like we're really becoming destination healthcare that, makes it much easier to access and increases the quality of life. And that's what we focus on, creating a culture of wellness. So great work happening in cardiology in the cancer space. And I know there's a lot of other things happening, especially in neuro and women's health. Tell us a little bit more about some of those great initiatives.
Yeah, we have some fantastic doctors working with us on the neuro service lines, Dr. Dumont and Dr. Kalikia and LCMC, the VP. And more recently, we started the Healthy Brain Initiative with Dr. Mariganori at UMC. And that has taken off as a way to, provide screenings for dementia patients and help treat those patients. In addition, we have a lot of focus on stroke care. We have 2 comprehensive stroke centers, and UMC does strokes as well. So a lot of focus on improving outcomes, providing access, and creating a great place to receive care in the neuroscience space.
That's so important because we know that neurocare in a timely manner can make the difference in someone, returning to their normal quality of life. So that's great that we have that ability across the system to care for people in that way. And tell us a little bit about women's health. What's happening there?
The OB space is really exciting. We have a fantastic leader, Dr. Elizabeth Blanton, who's in charge of that service line. And, LCMC is committed to the highest standards of care. That's evident in that we were most recently recognized as having 4 hospitals that are Birth Ready Plus, and then 1 hospital that's Birth Ready. And that's the highest level of standards in the state of Louisiana to improve outcomes and make sure we're serving that population well.
That's wonderful. Sounds like we are really trying to cover everyone's needs and in really meaningful, impactful ways. So thank you for the work that you're doing, and thank you for sharing that, Rob. And it's so important, right? LCMC Health has a culture of creating wellness for those in our community and individuals who are employed here at LCMC Health. Tell us a little bit about what you, Rob, do to make sure that you preserve and take care of your personal well-being.
Well, that's a timely question because I'm currently training for the Crescent City Classic along with 70 other people at West Jeff, and I think there's 500 across the system. I'm really excited about that. I'm not a runner, so it's a little bit, something I probably wouldn't take on otherwise, but I feel great doing it. I'm excited about it. LCMC is the keynote sponsor for that event. It's going to be a wonderful, wonderful time, and I look forward to doing it.
Yeah. So thank you, Rob, for being here today and really sharing all that you're doing, for LCMC Health to assure that we provide the best care, the most innovative care right here in New Orleans for not only this community, but the region. And thank you for, sharing that about yourself and how you care for your personal well-being. It's truly impactful for all of us. So thank you so much for joining us today on Beyond Extraordinary.
Thanks so much, Kristen. Glad to be here.
Thank you. Thank you for listening. Join us as we go beyond extraordinary on every 4th Tuesday of the month.